Hello, everyone. My name is Jordan C. I'm a clinician educator fellow at the University of Pittsburgh, and this is Calmer Conflict, a novel approach to de-escalating patient anger. I'll start with a moment during my intern year that's difficult to forget. I remember standing in the doorway of a 45-year-old man who I had just admitted for a GI bleed. He was shaking, not from illness, but from frustration. Laying in bed in a faded hospital gown, one leg falling over the edge, ECG leads were ripped off and laying on the floor. His hands, I remember, were clenched and they were punching at the air as he shouted, "What kind of hospital is this? Do you even know what you're doing?" I opened my mouth and out came nothing. You see, healthcare workers are 5 times more likely to experience workplace violence than the average American worker, and verbal aggression is commonplace. Now, this leads to higher rates of burnout and depression with lower job satisfaction, and it's something that we can all relate to and our students worry about. So last year, I gathered together a group of communication experts from the fields of psychiatry, palliative care, and internal medicine, and we conducted an extensive literature review of the evidence, pooled our collective opinions, and we identified 6 specific skills. We put them into a specific order, and we created a mnemonic, which we called Calmer. And this is that framework for more effective verbal de-escalation. I have 2 objectives for this talk, and they really relate to the 2 functions of the framework. Now, during patient encounters with anger and high emotion, the first objective is to outline the skills that allow you to align yourself on the same side as the patient, so to find that common ground. And then second is to then identify the skills to create and implement a mutually agreed upon plan. So I imagine my interaction with my patient as if we were on a bridge. So this starts us off with the first skill, and that's the C, stay calm. Having a calm tone of voice and a steady pace. That it's hard not to focus on our own feelings. I know I was pretty anxious and self-conscious when I confronted my patient in intern year, but I know that the conversation is likely to be heated. Sometimes what I'll do is I'll take a few mindful breaths outside the room just to prepare and then come in with calm sense to go about the encounter. Now, if this is the first skill, then really that leads us to the words we actually use, and that's going to be next. So we're going to go on to the A, which is acknowledge. Before we address the patient's emotions, it's vital to acknowledge that their concern is valid, it's important, and it will be addressed. As physicians, I think our default is often to try to fix the problem, but jumping to solutions gives the patient something to argue against. So instead, we acknowledge the concern, and evidence suggests that one of the best ways to do this is to agree. Not necessarily with their behavior, but with their concern. So for instance, with my patient, I could have agreed with the facts, something like, "I agree that you've waited a long time." Or maybe in principle, "I agree that every patient deserves respect." Agreement leaves the patient without resistance to push against, and it's just really hard to fight against someone who's not fighting back. So this is the first skill that gets us a little bit closer to our patient. Next is to listen. So we've all practiced active listening, and it's pivotal here. The nonverbals such as nodding and leaning forward are so important. NURSE statements, a common acronym standing for name, understand, respect, support, and explore, are often taught to facilitate active listening. And what we found is that naming anger often leads to anger. So instead of using the N in the NURSE statements, perhaps there can be more effective vocabulary. So for instance, I cannot imagine what you've been through, an understand type statement. Or tell me more about what's going on. Full stop, more of an explore statement. Gets us a little bit closer to our patient, but I would really encourage you to pair this with the next skill. Anger and agitation are rarely the starting point, and they almost always are fueled by some underlying emotion. Fear, anxiety, loss of control. These are understandable, but not always explicitly said aloud. So the next skill is M, standing for mirror. Now, mirroring throws a lifeline to the patient in the sense that we aren't just saying that we understand, but rather we are demonstrating our understanding. So after listening to the patient speak, we can use certain phrases that can be helpful here. For instance, what I'm hearing is. So what I'm hearing is you're feeling really anxious about what comes next. Or it seems like you're really nervous about tomorrow. This was my patient, actually, back in intern year when we had that confrontation, that my patient had really waited all day for a colonoscopy to stop his bleeding. He had been admitted for that GI bleed, and he knew nothing of the plan. So what I'm hearing is you're really nervous about tomorrow. Verbalizing those primary emotions really leads to one of two scenarios. Either the patient will say no, and they'll tell you what they really are feeling, or they'll say yes, that exactly, that is what I'm feeling. I am nervous. Of course I'm nervous. And that's what gets you one step closer to see where they're coming from. Now, had I done that with my patient, that he no longer would have just been another angry patient, but rather a person who was nervous. And that's something that I can understand. So after these 4 skills, gets us a little bit closer to our patient, and you'll notice that we're probably more than halfway there. Something that I would encourage you, though, is that oftentimes we need to repeat these skills, and sometimes they need to be done out of order. You see, agitated patients often can't internalize what we say the first time, so using different words for these skills can help. So different vocabulary for the skills. Maybe I need to go back and agree some more. I need to do some more active listening. But the idea is that through that repetition, we can find some common ground to be able to find a path forward. This is where the second objective comes in. So we're going to start with the E, which is empower. Now, empowering the patient with choices in the sense that now we have the info to give very specific options. It's vital to address the patient's primary concern here, but there are also certain choices that all patients should be allowed to make. The first, for instance, is information. So I could have said something like, would you like me to update your father on your illness? Would you like to check now or later? Or can I come back? Or would you like to have a family meeting? Or perhaps, can we change the route of your medications? Offering choices of PO versus IM, IV, lozenge, or syrup, patch, or cream, that up until now, the patient has been told no so many times, and this way allows them to say no back to you, or yes, that's what will work for me, and that choice is empowering. And then finally, for the last skill here, is we're going to end with responsibility. So think about how many people have dismissed patients like this. For instance, my patient had probably seen half a dozen providers in the emergency department, and the admitting team and likely have been likely perceived that their concerns were going unnoticed, but not you. So the R standing for responsibility is going to verbalize a statement such as, we will figure this out together, and I will be back in an hour with updates. Or perhaps, I'm here to take care of you, so I'll go work on these things that we talked about. Taking responsibility for the plan and protecting that therapeutic alliance that you've built is how we end these encounters. Looking back, I wish I had known these skills when I was in my intern year, as this framework really changed the way that I talk with my patients. I thank you all for your attention, and the next time you find yourselves in a heated moment, I hope that this helps you find calmer conflict.